Hello? 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 Okay, it's working. One day, we'll hop on and figure this out. Hello for anyone joining me on today's live. I do have a delay. Again, I'm still trying to work it out. And yeah. And for some reason, my chat box disappeared again. So I'm going to watch the live chat from my phone and monitor any questions or suggestions. Or otherwise, I'm just going to get started. Let me see here. The delay is really big from what I can tell. Okay. Oops. Okay, I hope you all can see me well. I have a delay, but I am going to go ahead and get started so that I can be mindful of your time. So I'm going live for a second time today. Last week was my first. So in today's agenda, I'm going to go over Medicine Cabinet Monday, our Medicine Cabinet Mondays. We're going to talk about what's in your medicine cabinet, why it's in your medicine cabinet, and just, I guess, high level information about different medications that you might be taking, or if you know someone that is taking this particular medication, what to look out for. And then in the second part of our live today, we are going to go over part 2 of the types of books you should read if you're a woman over 40. Whole new set of books. So I hope that you will appreciate the second part of this series. All right. I just wanted to let everyone watching, if you watching it live or if you're watching the replay, my latest video is up. If you are interested, please check it out. Hopefully you'll be interested because a lot of us are, I wouldn't say a lot of us, but I think the majority of women from my analytics that I can tell are over 40. And so this is a really important video for you if you're over 40 or if you know someone who is over 40. So you might be a younger viewer and might know someone, your mother, sisters, friends, aunts, who might need this information. So I encourage you to go out there, watch the video, and like, comment, subscribe. Also, YouTube suggested I change the thumbnail on my video, my previous video about therapy and steps 3 and 4 of the Elevate Yourself series. So this video was still up. I did change you just need a little bit of a refresher and some basic knowledge on how to use the medication. So the first is Tylenol or acetaminophen. This product is used for pain relief and fever reduction, number 1. The maximum dose, which I really want to stress, is that it's 4,000 milligrams per day, usually dosed 650 to 1,000 milligrams every 4 to 6 hours, PRN or as needed. Tylenol, I would say, It works by inhibiting the production of the prostaglandin. You will see their brands or their generic associated with this particular medication. So with Walmart, it's going to be Equate. With CVS, it's just going to be a CVS Health brand. With Kroger, it's the Kroger acetaminophen brand. Um, with the Tylenol, don't use it in combination with any other medications containing acetaminophen, and also because that's you're going to want to avoid accidental overdose. So it's going to be really important for you to pay attention to the dosing of this particular product, and just use it when you need it. I haven't, I would say, I didn't talk about herbal medications in today's live. I can do that on another video. This is just your standard pharma, popular cabinet medication. So that's what I'm going to be continuing in the next 4 products that I'm going to go over. I hope I make sense. All right, so the next item is ibuprofen, brand name Advil and Motrin. It's a non-steroidal anti-inflammatory drug, or an NSAID, popularly known when you truncate the name. It's used for pain, inflammation, and fever. I'm certain many of you have this in your house, or may have had this in your house. Maximum dosing of this product is 3,200 milligrams per day, so you do not want to exceed this dose for various reasons. Again, that's your liver that's involved. So this particular product, ibuprofen, and I'm sorry, it looks like my chemical structure is cut off there, but it works by blocking the enzyme COX, which is responsible for the production of inflammatory chemicals in the body. You want to take ibuprofen with food or milk to reduce stomach irritation, and avoid using if you have a history of GI issues or gastrointestinal issues such as ulcers. Also, be cautious of the potential interaction with blood thinners, and avoid, again, using with other NSAIDs. So that's similar. You don't want to have additive medications one on top of the other. So you're not going to take Motrin and Advil at the same time. Same thing with the generics that you'll find in your local grocery store or your local department shopping center. You don't want to take all of these different types of medication, brand name or not, at the same time. Let me go on to the next product. Okay, so the next product is diphenhydramine, or Benadryl. This is an antihistamine that is used for allergies, itching, and as a sleep aid. I've read stories about parents who give their children Benadryl when they're too cranky and can't really fall asleep, but sometimes it has, and I forget the terminology, it has this effect where it might actually keep your child awake as opposed to putting them to sleep. I wish I remember the name, but just be careful if you're trying to use this product for a sleep aid. It might not always work as intended. So Benadryl, or diphenhydramine. So diphenhydramine is the generic name. Benadryl is the brand name. So when I say allergies, I'm talking about itching, sneezing, runny nose, the watery eyes, and the sedative properties I've also talked about. Also, there have been some studies that have shown that it's helpful for motion sickness. Benadryl can cause drowsiness. That's a really important thing to be reminded of. It can cause drowsiness, and that's the thing, that it's a sleep aid, so it does cause drowsiness as well as in adults. So you don't want to drive after you've taken Benadryl, operate heavy machinery after you've taken Benadryl. You really want to be cautious of this. And also, for those of you who, we always have to counsel our patients, whether or not, we can't make assumptions, but we have to let patients know that it can have an additive sedative effect, and you should not take it with alcohol, and you want to avoid taking it long term. If you're having an issue with allergies and itching and sleep, you want to go see a provider as soon as you can to help rectify what might be going on. It might not be, what you think it is. So always keep that in the back of your mind. Certain products have a cap, how many days you want to use it before you go and see a provider. So always be mindful and always be cautious of that when you're taking medication. Okay. Then next on the list we have antacid, which are commonly known as Tums and Rolaids. So these products are used to neutralize stomach acid and relieve heartburn and indigestion. So the maximum dose of 7,500 milligrams per day at the regular strength. So this is not maximum strength. And so they usually say to take 2 to 4 tablets as needed, not exceeding 15 tablets in 24 hours. So it's calcium carbonate for those of you who are not familiar or don't know. And also, don't take Tums 2 weeks consecutively without consulting a healthcare provider, which I just mentioned before. It could be something more serious. Be aware of potential interactions with other medications, such as antibiotics, and also avoid taking it with high fiber meals because that can reduce its effectiveness. Okay, and the last product in the live, and I do apologize if I'm having delay. I think it might be streaming and recording with the delay. I really got to figure it out, but I have can lead to ineffective treatment and dangerous side effects. Also, beware of the side effects. Familiar yourself with the common side effects that are normally seen with the particular medication you have in your medicine cabinet. Understand drug interactions between the products you're taking and other products you might be taking, that are just sitting in your cabinet or that have been prescribed by your physician or your nurse practitioner. It's going to be really important to understand that. Also, with alcohol use, again, I mentioned that before, combining alcohol with certain medications can be dangerous, leading to certain side effects, liver damage, reduced drug effectiveness. So always check this and be very, very aware of this. Expiration dates is a very important thing. Medications lose their effectiveness over time. So if you're having medication just stored in a particular area of your home, it could be maybe it's damp or wet, or the medication may have lost its effectiveness on top of having that expiration date. So you don't want to try it. You don't want to try to use a medication that has been expired. So always check your medications before taking them, even before buying them. I've seen medications on the shelf in different pharmacies that have an expiration date in 1 to 2 months. So you definitely don't want to spend your money on that if it's not necessary. Save your money and look for something that you need that's going to have a longer expiration date, preferably a year or 2 out, actually, I would say. Again, I talked about proper storage. Store medication in a cool, dry place away from direct sunlight. Some drugs might require refrigeration, and proper storage ensures that medication remains effective for how long it's supposed to last. Avoid sharing medications with other people, please. I understand sometimes you share pain medication, headache medication. If you have a headache, can I have 2 of these or 3 of these, that type of thing. I'm not going to completely outlaw, even though I didn't make the law, I'm not going to completely say that's wrong, because if you're sick or if you have a headache and somebody has medication in a tablet sealed, that might be beneficial for you at the time, but always be considerate about those over-the-counter medications and whether you want to be sharing medications. Prescription medications is a definite no-no, but just take caution if you're going to take medication from somebody else, because you don't know how they stored it. You don't know if a couple of pills fell on the floor and they put them back in the bottle. You just don't know, so just be careful. Another thing I want to talk about is adherence to treatment. So this is more so for prescribed medication. Always adhere to the medication as prescribed. And also with those maximum daily dose tips that I gave you, please be very cautious. It's there for a reason, and that's to protect your liver, to protect your organs, and to make sure you're not going over the amount that's intended. Also, again, I talked about side effects. Beware of the side effects that these drugs have. It's going to be very important because they might exacerbate something that's already going on within your body. So do be careful. And also be careful of allergies and sensitivities. Inform your healthcare provider if you have a drug allergy or known sensitivity, because there are certain medications you may want to avoid. Another thing I want to just let some of you know, if you are still pregnant or breastfeeding, because it's a really big issue, because drugs pass through your milk onto the baby, they pass through your body into your, into the fetus. So you're always going to want to be cautious of what you're taking if you're pregnant or breastfeeding. Some drugs can affect those two particular situations, and so always consult a healthcare provider before taking any medication if you are pregnant or planning to become pregnant or breastfeeding. All right? So, I think I'm gonna have to really work on my live skills. So, thank you for your patience. And there is more. I do have a follow up live video that I'm planning, and I want to discuss the role that the liver plays in detoxification and metabolism in our bodies. I spoke about that first pass effect for oral medications, but there is so much to know about metabolism, detoxification, toxicity, and how to keep your liver healthy as it is processing drugs and food and all the byproducts of these different agents. So that's something that I'm going to work on, and hopefully I'll have it with you guys in the future. Okay, so now I'm going to jump into the 5 types of books every woman should read, part 2. I'm going to give myself a moment here to look at my live and to see how choppy it is. I think you can hear me well, but you just can't. The video is, maybe it's not enough power. I'm going to jump into the 5 types of books every woman should read, part 2. I'm going to give myself a moment here to look at my live. Yeah, so the video is choppy, but you can hear me well. So I'm going to continue, and I'm going to continue the live and then continue to work out my AV issues. So I apologize in advance if my head gets stuck in one place, but my voice continues. All right. All right. So let's jump into the 5 types of books every woman over 40 should read, part 2. I had a really nice live last week, and I had a few discussion points that came in through the live, which I really appreciated. That's posted. Go check it out. It was a really fun live to do. So let's talk about part 2. So number 6 is leisure and fiction. All right. So with leisure and fiction, please don't judge me, folks. Don't judge me. I read this series, I think 3 audiobooks, and 1 I picked up the book to read. So this is Anna Huang's Twisted series. So the reason I picked up this for leisure and for leisure only is because I think it popped up in one of my book feeds, a popular series that was released a few years ago. And so I decided to listen to the audiobook. The narrators had great voices. I said, oh, this is interesting. I'm going to listen. But the book itself, the actual story, I don't know if you've read it, but it was really twisted. It's so, but I was hooked. I had to read the story through to get to the end, like what's going to happen with this couple or with these couples involved. So it's a book about 4 different couples that go through whatever type of relationship trials and tribulations and triumphs that they go through. But I did read the series. I mean, I listened to the first 3 on audiobook, and then Twisted Lies, I actually read the book so that I can just get through the series and figure out the conclusion of this series. These types of books I don't normally read. I think in high school we used to read something like, I don't know if in high school these were so popular. They weren't really, but a lot of young women were reading these types of books. I wouldn't say high school, but maybe college age and above, that were really giving their feedback and reviews on this particular series. So I read it. I thought interesting, but be careful what you read. You might get hooked into reading something you're not used to, but also just give yourself an opportunity to read something of leisure that makes sense to you and that is good for you, that won't trigger you. There was a lot of triggers in these books, I will say. There's a lot of triggers um, on abuse, on different types of manipulation, narcissism. So I would be careful before you jump into reading these books. So especially this series. So let me go into the next. This book I actually did read in high school, White Teeth, excuse me, by Zadie Smith. I picked it up again because I wanted to reread it. It's a story about, I think, an English family and then an immigrant family. The two men of the family are friends, but they have some type of relationships to work out. I can't remember the exact, but I just started reading it again. And it starts off with, I think, a man who's sitting in front of a butcher's shop, who's going to do something that's not so good, but the butcher shop owner, who is an immigrant, comes and tells the man, "Don't do what you're supposed to do in your car." And it's a story about families that know each other, that are friends, and I think their children. The highlight of the story is really about their children and what they're going through as adolescents in England in the 90s. I think the book is based in the 90s. That's when she wrote it. That's when I read it. So I'm giving this book a go ahead again. And yeah, so read for leisure, read when you have time, pick up books and try to make yourself comfortable. I did overhear someone on a podcast on, I think it's called Marie Fortio or Forleo. She had somebody on her podcast that once mentioned, do not read a good book before going to bed because you will not want to put the book down. So that is my advice to you. If you pick up a good book, don't read it before bed. Give yourself time during the day to read it because it's going to take away from your sleep. I lost some sleep with a few books in the past. So let me read it. Hey, Kale. Yeah, White Teeth. Check out White Teeth. It's by Zadie Smith. It's an old book, but a lot of books are old, so you can still check it out. Yeah, I'll try to do better about posting when I'm going to go live. I try to put it in my community tab. I try to schedule it, but if it's not an actual video, I don't think I can schedule it and it doesn't pop up, but I'll figure it out. I mean, I might make this a standing Monday, 4 p.m. Central Standard thing, but you know, um, so KL, just want to let you know I did do a first part of the live, and that I spoke about medications, the medicine cabinet Mondays. So if you have time, just go back and watch the first part if you're interested. I talked about 5 different very common and popular medications that we have in our medicine cabinets. I talked about how to use it, why we're using it, what to look out for when using it. And so this will be posted after I'm done, I guess. YouTube will take it into the live and post it. So yeah, I'm sorry about that, that I wasn't able to do a better job of letting you guys know that I was going to go live. So I'll get better at it. This is just my second time going live. So we'll get better. We'll get better. All right. So let's go into number 7 on the list, careers. Now, I couldn't find too many books on careers. I'll be sincere with you. A lot of us might be mid-career. A lot of us might be trying to figure out what career works best. And I think it's going to be solely independent on what you want to do, how you want to do it. Some of us are changing careers midlife. I know of certain people who are like, they're just tired of the career that they have and they want to change trajectory, which is okay. It's not a bad thing. If it's time for you to move on, you need to move on. But I bought this book because I was really looking for ways to become better at what I was doing and what I can do, even if it's not in what I'm doing as a pharmacist per se, but maybe something outside of pharmacist. Maybe it could be business related. So this book I bought, The Four Disciplines of Execution. I haven't finished reading it yet, but it talks about, I'll just tell you what the four disciplines are. The four disciplines are focus, leverage, engagement, and accountability. So these are the things that will help you succeed, supposedly, in your work. But I do believe it. I do believe focus, leverage, engagement, and accountability are all things that can allow you to succeed, not only in your day-to-day job, but maybe in your business, maybe if there's something you want to move on to in your career, as a career. It's going to take some finessing, some understanding of what it is going to take you to succeed. So I think that execution for me is such a big deal. Um, like, you could have all the things on your to-do list, on your vision board, all the things in your notes, like that you can make all the plans, but how do you execute and execute well? You know what I'm saying? Those are the things that I always think about. It's like you could have all the plans in the world, but how do you execute them? And execute them with, precision, with some type of accuracy, with putting your all into it. So I think that, hopefully this book might be helpful. Again, don't buy any books just yet. Go on to your library app and borrow these books, or go to your library and borrow these books first to see if you'll like them, if they're going to be good for your personal library. I talk about Libby and other ways you can look online for free book borrowing systems in my first live stream. So I'll try to link that in the description of this live stream, but I do encourage you to first borrow, read synopses, try to get an understanding of the book and see if it's going to be something that you like. Let me check yeah, I agree. I agree, Kale. Oh, also, Kale, I know I spoke about this last week. My chat is gone. I have no idea what I did with it. So I think I have to go live, like a dummy live, maybe later today, and figure out where my chat box. Because usually I'm supposed to chat back, but everything is gone. Everything is missing. I don't know why. But let me keep going. And yeah, I think I'll do that. I'll do a dummy live and figure out where my chat box. Because I can see all your chat boxes in on my other phone. Okay, so number 8, memoirs. I only have one memoir, and it's the last memoir that I recently finished. I think memoirs are good, just because it's always good to read about someone's life stories, their trials, tribulations, triumphs, how they came up and where they are now, their perseverance. The last memoir I read was Viola Davis. Viola Davis, the EGOT winner and the author. I read this last year. So I read 1/3 of the book via the Libby app, and then because she narrated her own story, I decided to listen to her narrate the rest of her book. And I would advise any of you who are interested in reading her book, reading her life story, to listen to the audiobook. She's an actress, so she's going to act out her words in the book, and I thought it was awesome. Again, I read this last year, middle of last year, so I can't tell you the bits and pieces. I mean, she was born and raised in Rhode Island, went off to Hollywood. She struggled for a while, but she also went to Juilliard. She also went to a great school. So I think that, hey, cool. Yes, Gail's been using the Libby app. Yes, awesome. Cool, cool, cool. Yeah, I've been using it more and more too. But like I said, reading good books at night might keep you up. So anyways, yeah, this is the last memoir. I tried to pick up Michelle Obama's memoir, but it was like 500 pages. So I was like, maybe next time. I shouldn't do that. But yeah, I know Kerry Washington has a memoir. I mean, these are all actresses and politician wives. There are other memoirs that are out there that I didn't have a chance to put into my slide deck. But yeah, give it a go. Try and meet some memoirs. If you're writing your own memoir, maybe you can pull some tips and tricks from what you've been reading from other people's books. So give it a go, and let me know if there are any memoirs that you've read in the past that have inspired you, because I'm always looking for new things to read. If you give me a recommendation, I'm going to take the recommendation and I'm going to look into it. I really am. That's what happened with the Don't Judge Me, Anna Hoying's. It was a recommendation that popped up. I gave it a go, and look, I finished all four of those books. All right, so let's keep moving. Let's check ourselves for time. Okay. So that's Viola Davis. Now I want to talk about hobbies and crafts. We as women, we need to have an outlet for us to just do fun stuff. This has nothing to do with work, nothing to do with your responsibilities in the home life, or maybe it does. You know, you might find that your hobby is cooking, so you'll be cooking 3, 4, 5 meals a day. That might be it. Actually, I shouldn't say that. That you should separate, regular life from your hobbies and crafts. But for me, hobbies and crafts mean something that I get to do on my time, on my leisure time. That's fun for me. That helps me spark a little bit of joy and curiosity. And honestly, I think the last book I read about hobbies and crafts and finding your true voice, this book was recommended and to me in a writing group, and it is The Artist's Way by Julia Cameron, A Spiritual Path to Higher Creativity. Now, a lot of writers buy this book, and when I was in the throes of trying to write better, I write and I published a few articles on Medium. I can leave a link to that, my account. I haven't published in such a long time on Medium. Medium's been going through this crazy phase, but I'm still gonna get back into Medium eventually. But yeah, so when I was in the throes of trying to improve my writing, I've always struggled with writing, even as a student. I picked up this book to just try to get a little bit more inspiration and creativity, and not be so down on myself, because the writing groups that I was in, these are writers who have published 1, 2, 3 books. They were, really, they had their sentence structure well, they had their plot, they had their character development, they had all these things already set up and laid out. And here I was, struggling to write sentences with the correct, I don't know how to say it. When you're writing fiction and you're writing character points of view, there are certain ways you're supposed to structure your sentences. So that's always something that I'm going to be working on, is improving my writing. And so this is one of the books that I picked up. Now, there are other hobbies or crafts that you might be interested in: sewing, cooking, swimming, canoeing. It could be a whole bunch of other things that you might want to get involved in. So I do encourage you to pick up a book and figure it out, and just try to be okay with exploration and getting yourself out there. Be explorative. Don't be closed off. You might do something that you never thought you could have done, and then you just absolutely love it. So I would encourage you to seek some hobbies that might inspire you. Okay. I love this comment for the Michelle Obama book. She said 500 pages, no way. Yep, that's what I did. I was like, not today. Maybe another time. Or she narrates her book. Maybe she has it on audiobook. I don't know. Maybe Michelle Obama has narrated her own book. I'll listen to it on to and from work, in the kitchen. I can do that. I guess I'll look on Libby if she had narrated the book. Okay, so let me jump into, and I apologize. I have a delay. It's still delay. I think if I go live, because I'm using OBS, if I go live without OBS, I don't think I'll have the streaming issues that I'm having and the delay. But it's through OBS that I'm able to set up this nice little, I don't know, presentation that you see here. The other day I was watching Ask Debbie About Hair, and she's been going live with just her phone. I think she's live on like Facebook, Instagram, and YouTube. And so she just had her phone in the vertical format. And I'm just like, why don't I do that? Just go. But I like to give a presentation. I like to show, not just tell. She does a lot of juicing and, smoothie. She does get on live and make the stuff live. But that's for future. I can do that in the future because I actually like cooking and doing my own juicing and stuff. So yes, let me get into the last book or type of book that I think you should read, and that is going to be a book on spirituality or books on spirituality. So for me, as a Muslim, I turn to the Quran as the guide for me, and that's the book I read daily. For you, you might be a woman of the same faith, so you're going to read this book, or you might be a woman of another faith, so you're going to read a different book. And I spoke about this in my last video. You might be also a woman who doesn't ascribe to a particular faith, but I would still advise you to get in tune with your spirituality and start learning about your spirituality and start reading up on spirituality, whatever that's going to be or mean for you. Um, Another book that I have read and need to return to is a book, Al Ghazali, on disciplining the self. I've been trying to learn more about self discipline, and it could be from a lot of things: negative thoughts, bad foods that are not nutritious from you, speaking negative things to other people, to yourself, doing things that aren't good. So I've been trying to get into more of the disciplining self. A part of that for me has been my fitness journey and getting into the gym, not even going back to the gym. I mean, I'm talking about getting into the gym as a newbie, and trying to figure out ways to become healthy because I'm over 40. And I know that a lot of you women who are watching this are over 40. And so you are trying to get healthy, get fit, discipline yourself more with regards to the food you're eating. And, you want to look good, you want to be healthy, you want to get ready for your later years. And so this is a book that I've been reading just to help me become more disciplined. And a lot of it is the religious aspect, but a lot of it can be attributed to your day-to-day life. So I would encourage you to tap into your spirituality, and learn more about your spirituality. I'm also going to advise you to look into books or cards of affirmations. This is something that I know a lot of women do. They have daily affirmations. They share daily affirmations. At my work, there's a particular group that sends daily affirmations, and they can be helpful for a lot of people, especially if you're in perhaps a toxic work environment, a toxic situation or a relationship. Sometimes you need these affirmations to get you through the day, the evening, the night. But I also would advise you to really work on your particular situation. If you need to modify that relationship, however that means, go ahead and do that. If you need to start looking for new jobs, new careers, because something is too toxic or heavy on you, go ahead and do that. I would invite you to always explore and to not feel stuck. So yes, books or cards of affirmations might be something you need to get you through, to help you tap into your spirituality. And so really, when I talk about the types of books that you should be reading, the goal is not to overconsume, but to find inspiration if you are in need of some. So I've spoken about travel, I've spoken about health and wellness, I've spoken about different types of books that we women should be getting into, including finance books. So yeah, I just wanted to share those types of books, and hopefully they are beneficial for you as you start to explore. I really encourage you to seek free resources and borrow books before you buy them if you can. That's always a good way to start. That's always a good way to get into learning more about different things. And if you watch my first live, I leave the 3 resources that you should be looking at first if you want to borrow. One is, one is Libby, one is I forget the name of it, Archives. It's internet archives. And the third is the Gutenberg Project. So check those out if you're looking to borrow books. Let me go on to the next slide. Okay, This is the last slide. Thank you for joining me for the live. I will try to improve the audio and visual. I do apologize again. Um, so let me answer some questions while I still am on the live because I know if I cut it off, the end will be cut off. Um, the audio is perfect, but there is a slight delay. Oh, thank you for telling me, KL. The audio is perfect, but there's a slight delay. Okay. I think I can go live without this whole frou-frou presentation, but I really like the presentation, and then we'll be okay, but I don't know. I just have to figure that out. I really do. I'm using Wi-Fi. Nah, I don't know. Um, so this book, the Al Ghazali book, I think is what you're asking me. I don't think it's on Libby, but I will try and see if I can find a free PDF version. Some of these books have been translated from a different language over to English, and so a lot of scholarly sites will post them so I can yep, we all need discipline. I hear you. So I can post the link to a free PDF if I can find it. But I don't know. I don't think it's on Libby. Um, let's see here. So I'm chilling because if I stop the video now, you won't hear everything I have to say. So let me hear what I can get you through to help you tap into your spirituality. And so, really, when I talk about the types of books that you should be reading, the goal is not to overconsume, but to find inspiration. Okay. Ooh. I do thank you for joining me for the live. It looks like I'm gonna have to wait a few more minutes before I can close the live, or else you won't see this last slide of mine. So it's like I gotta. Sorry, I'm still live looking at my live playback, and it's